Hey everyone, it's Lorie Brown and welcome back to our COVID-19 survival guide for nurses and healthcare professionals. And I'm really excited about today's special guest, Kimberly Kent. Kim, welcome.
Morning, afternoon actually. Good afternoon.
and Kimberly's a nurse as well as an attorney, as is myself, and we know each other from the American Association of Nurse Attorneys. And Kimberly was very active in getting the position statement from the American Association of Nurse Attorneys done to put our organization's information out there on how nurses can protect themselves and what our recommendations are. So thank you for being part of that.
Welcome. That was a lot of work and it's constantly changing. The rules are changing. As we were just talking before this started, today's news is old news tomorrow. It's really rapidly changing.
So we're going to share as much up-to-date information as we can, but know it could change tomorrow. And just a disclaimer, this is not legal advice. Kimberly's a nurse attorney in Arizona, and I'm licensed in Indiana and Illinois, but this is not creating an attorney-client relationship or anything like that. We're just trying to educate on what may be best practices to help you in this unprecedented era. So Kimberly, would you like to share a little bit about your practice, your law practice?
Well, I have been a medical malpractice healthcare attorney for over 27 years. I started as an LPN. Actually, I started as a nursing assistant in the early 70s, and I became an LPN and then a registered nurse. Most of my nursing career, I worked in the neonatal intensive care unit, but I've been a healthcare law lawyer and medical malpractice defense attorney for about 27 years. And so my practice is a wide variety. I have hospitals, I have physicians, nurses, you name it, in the healthcare provider world. They come to me for all different kinds of advice. A lot of it is litigation, some of it's transactional, people setting up businesses. It's a large variety.
You also do licensed defense of nurses, right?
Oh yeah, that's a good portion of our practice. Not just nurses, but physicians, counselors, therapists, etc. We represent a large portion of people who find themselves at the opposite end of a complaint.
Yeah, and you also do some employment law as well.
I actually do a little bit of plaintiff's employment law, and then I also represent 2 hospitals. So I see both sides of it, and I hear both sides of it. So I think that's a really good, well-rounded experience. Some people might find that odd, but for me, it provides a well-rounded view of both sides of the coin. So I advise hospitals about how to treat their nurses fairly, and I advise nurses when they feel like they've been treated unfairly.
Yeah, that's great. So right now there's a lot of crazy things going on around. Like we have nurses who are getting fired from refusing to take care of patients without having proper PPE. We're seeing nurses who get fired for bringing their own masks to the hospital, all kinds of stuff. So let's talk about PPE and what are nurses' rights and responsibilities to make sure they have proper PPE?
First of all, I think you need to be learned on what PPE is and what is required in the setting. So based on current guidelines as of today, which is what, April 2nd, 2020, PPE is eye protective wear, a gown, a mask, and we can sit here and debate about whether it should be an N95 or a surgical mask, but essentially I think the CDC and WHO is saying it depends on the setting, and so I don't want to get too technical on that, but you certainly need eyewear, a mask, a gown, and gloves at minimum. And best case scenario, or arguably what I try and tell nurses right now is, if you're not sure what's adequate, go back to standards pre-pandemic, okay? And whatever the standards were before the pandemic set in, that's what would be considered adequate. That would be the safest. So we want to kind of stick with the science before the pandemic because safety didn't change because of the virus.
Mm-hmm. But amount of masks available has changed.
It has, and so you know, nurses, here's what nurses are being asked to do, what they may be uncomfortable with. One is change from an N95 mask to a surgical mask. And we know N95s provide the most protection. If you're caring for an active COVID patient, you should not be using a surgical mask. You should absolutely have an N95 mask. If you're being asked to care for an active COVID patient without an N95 mask, you do not have PPE, as an example.
So what if a nurse is asked to go to work and there's no N95 mask available for them?
So let's first talk about what I think a nurse should do before this happens. So if you're a nurse and you're working in an active healthcare setting, and by the way, because the spread of this virus is going to quickly spread to outpatient areas, not just patients where we see. So we're going to see patients in nursing homes, obviously, but in rehab facilities, in outpatient facilities. So anytime there's persons suspected of COVID and there's persons who have been confirmed. But if you are in the clinical field where you could come in contact with either of those scenarios, I want you to try and make sure before you start your shift that you have the appropriate PPE, okay? And if you're not sure what that is, you need to nail that down first. So first know ahead of time what is appropriate and adequate in your setting. Then let's just take that example for a minute, Lorie. If a nurse comes in or has a shift tomorrow and she calls the night before or the morning of, and her colleague says, look, we just ran out of N95 masks, then I would recommend that nurse to not show up for work, because once she shows up for work, then she or he assumes responsibility for the patient. Then you have patient abandonment issues and you have ethical issues. It's very difficult to tell. I mean, all of us who have been nurses and who are nurses, we go into it because we're compassionate, right?
Right.
Away from a patient who needs us, we have to recognize in advance that we're going to potentially err on the side of helping the patient, when even though that seems like the correct thing to do, the moral thing to do, it's not, because then you put the risk of becoming infected on you and your family and the community at large. So it's really not the best thing. It might seem like the most moral and ethical thing to do, but it's not. So if you can avoid that, then you actually give the corporate people more power, because now they have to, by law, go in and relieve the people on shift. Once you get in there and assume care of the patient, now they've got 12 hours to kill, right? And now you're infected. So find out in advance if you have adequate and appropriate PPE. But let's say you've done all that and you're told you do and you're expecting to, and then you show up. My recommendation, and this is going to sound very harsh, but my recommendation is, before you go into that patient's room, you wait 15 minutes. After 15 minutes of determining that you do not have PPE, you get out of that building, you get in your car and drive home. I know that sounds harsh, but it provides corporate the leverage they need to get in there and help you. That's my recommendation. Once you assume care of that patient, now you've got a different ethical and legal obligation. Let's just say for some reason, we don't get to that point where you can walk 15 minutes out. Then for God's sakes, don't go in that patient's room, okay? Until you have adequate PPE. Do not go into that. And this is going to be hard. Patients are going to be screaming for pain medicine, water, or they might even be under a code arrest. But you cannot go in there, because if you do that, again, you're just making the problem worse. So my recommendation is to first find out, step one, find out in advance, do you have adequate PPE? If you arrive and you don't, 15 minutes, and you call the clock starts ticking and you're calling your CEO and you're saying, I'm walking out in 15 minutes for the protection of myself, my family, and my community. And then you walk out. If you have to stay for whatever reason, you're in a bind, you're going to have to stay outside that patient's room, not go in and have contact with that patient until PPE arrives. And naturally, you're taking all of this up the chain of command. You're calling your charge nurse, your supervisor, your CEO, your CNO, everybody in administration, and you're telling them this is a 911. That's my recommendation.
You know, in Indiana, you cannot, if you show up to work, you can't like refuse an assignment. If you are there and you're scheduled to work and you leave, even if you don't accept a patient assignment, they still consider it patient abandonment or job abandonment because you were scheduled to work and you didn't come. And I've represented nurses on a number of these cases. And I don't have a crystal ball to know what is going to happen because of this crisis. Will the boards be more lenient about these things? I don't know.
No, and I think that's fair, Lorie. I think nationwide, and I think I give this harsh advice, and along with that advice, you have to know that your action, while it would be the safest for you, your family, and your community, may still result in termination, may result in a board complaint, in which case you've got to immediately contact your nurse attorney in your area. You've got to immediately contact a lawyer who's experienced in this area. And I think my own personal opinion is the larger organizations like JCO and the CDC are going to really offer a lot of support for these nurses who take this harsh but really protective action for the community. It's one that nobody wants to be faced with, but if the choice is between declining care for a patient or infecting 50 more people behind you, it seems obvious what you have to do.
Yeah.
So I think now you want to be clear that you have made it clear with your supervisors today or whatever about what is adequate PPE. We don't want to be debating that at the patient's bedside.
Right. And so write it up. Don't just do the phone call with the chain of command. Write it and keep a copy for yourself. Take a picture of it on the phone, but get that documentation trail to protect yourself.
But even before that, let's deal with this proactively, right? We don't want to wait until this situation happens. So today, if you're listening to this podcast or this webinar today, go in, and if you have a debate with your supervisor about what is adequate PPE, there's probably, hopefully, an ethics committee or an infectious control board. There's somebody that you can get a hold of and raise that dispute and get it resolved. And if the resolution is in a manner that's not favorable to you, one you disagree with, then contact a lawyer, and potentially you might have to, hand in your resignation until the hospital is able to provide you adequate PPE. If the CNO comes down and says to you, well, I think you don't need an N95 in this situation because we're not sure. The patient I'll give you an example. Patient is suspected of having COVID-19 based on symptoms, but maybe even the COVID-19 test is negative. However, we know, again, that 30% of those tests are going to be a false negative. So we're really, most physicians now are treating the patient as presumed COVID-19 if they have the symptoms. Mm-hmm. If you're in a bind and you're not sure, try and get those things resolved in advance. In other words, write up your own query and say, if a patient has symptoms of COVID and is presumed COVID, but the test is negative, will you provide PPE? Do you agree that adequate PPE is an N95 mask, eye protective wear, gowns and gloves, etc.? So get that resolved in advance. Don't wait until the crisis moment to get it resolved.
And that's a smart approach because employment law is, in my opinion, very pro-employer. And the only causes of action that nurses have, there's no such thing really as wrongful termination because most states are employment at will. And unless they violated age discrimination, age, sex, race, and religion, or fired you because you spoke up, like I know there's a lot of doctors coming out saying, hey, I was fired because I spoke up about lack of equipment. Right. You won't have a cause of action. So I love Kimberly's advice of being proactive and getting these questions addressed early rather than at the time that they occur.
Right. And, even in Arizona, the laws nationwide really, and in Arizona, they favor the employer. But in this situation, there's probably a law that protects you against retaliation because if the hospital is asking you to care for a patient, the hospital or clinic or whatever, is asking you to care for a patient that is presumed COVID or has symptoms of a COVID, or just because now we're presuming everyone in the hospital has COVID because that's the safest thing to do, then they're not following recommended guidelines by the CDC. They're not following JCO. And you reporting them for not following those guidelines and then suffering retaliation from that is a protected act under the federal law and probably under the state law. But like for example, in Arizona, if you complain that the employer is not following the standard of care, that is a protected action under the Whistleblower Act. But you have to connect it to something that the employer is required to do by statute. So then the lawyer has to prove that the standard of care in this setting, if we were at trial in this setting, required adequate PPE, which doesn't seem like it would be hard to prove. But because of the constantly changing guidelines, you really need to this is why you really want to set it up straight in advance. The other thing I want to remind all of your listeners too is that it's really important to know that these issues have short deadlines in employment law. So if something happens, you really need to you might need to file a complaint right away. You don't want to sit on it. So there's usually a Department of Health complaint. You might have a board complaint that you would have to file yourself, but doing nothing, there's a very short timeline in employment law. It's not like the statute of limitation where you have 2 years.
Almost like for medical malpractice.
Right.
Yeah, employment law, you have to file, is it 180 days to file an EEOC claim?
Right, but and most state statutes will hold you to that as well. So that's a very short timeline to get a lawyer involved. Now, obviously, these things are going to be resolved at the bedside sooner. But if you want to pursue that legal action, for example, for wrongful termination, then you would want to be sure that you knew all of your listeners should know that those deadlines for taking that legal action are very short.
Yeah. And some nurses think, well, I'll just file a complaint with OSHA. And so have you had any experience with that?
Well, I have had experience with OSHA, but I haven't had experience with OSHA and COVID-19. The problem with OSHA is it doesn't create a private right of action. So if OSHA finds a violation, they'll issue a penalty against the employer, but they won't provide any relief necessarily to you. Sometimes they can intervene. For example, it's the DOJ though that gets involved in that. So it wouldn't be OSHA on a wrongful termination, but OSHA cannot really help you in terms of your private right of action. They might be able to get the facility to correct the conditions, but you're not going to get any repayment, for example, of back wages or something of that relief.
Yeah, and who knows when OSHA will be able to get involved too. It's going to take a while, and again, it's not going to help you right now.
No. The best course of action is to deal with this proactively. Think of every potential scenario that could come up in your clinical workplace, and then put these questions to the test, to your administration immediately, and get answers. And if you're not comfortable with answers, resign and get a job somewhere else. Your life, the life of your family, the life of the community is not worth making these mistakes just because. And I know that corporate is run by good people, but I had a call today from a couple of nurses at a very, very large hospital that is a regional hospital, and I won't name their names, but I got a call from them today, and corporate was literally telling, I'll just anecdotally telling the interpreters, okay, because they're not involved in patient care, right? They're not involved in hands-on care, but they stand right next to the bedside, and they were telling the interpreters that they could not have masks of any kind.
Oh my gosh. Oh.
And so, the nursing administrator called me so that we could help them deal with that immediately. And eventually we got the corporate to reverse course. We also, in the meantime, got homemade masks and filters to the interpreters.
Yeah, and some nurses are getting fired for wearing their own mask from home.
So in that regard, I think JCO came out with a really strong statement, and I would rely on that. okay, President Trump is supposed to be announcing today that he is recommending that every person in the United States go out in public with a homemade mask, okay? So if you have to wear, if the recommendation is to wear a cloth mask to the grocery store, you tell me that a nurse can't bring their own mask in at home if the hospital won't provide it. This is apocalyptic standards, right? I mean, no one thinks that this would happen. And I personally would not be comfortable taking care of a patient with a homemade mask and a filter, but I wear them to the grocery store. And I've been wearing them to the grocery store, by the way, because I saw this coming. And I'm not panic stricken. I'm trying to keep myself safe so I can help my healthcare workers, so I can keep my family safe. This is not about panic.
Right.
It's about sensible, you know, I wish I had a surgical mask or an N95 to wear, but I don't. Those have to be reserved for our healthcare providers. So
Right.
I think JCO has come out with a pretty strong statement. If for no other reason, like for example, they mentioned maybe you're a nurse and you feel like you're at increased risk just because of your personal health conditions. Maybe you have asthma, maybe you're over 60, or you know, you meet the criteria for a higher risk. If I'm that nurse, I would go in and say, I want an N95 for all my patient care, because I can't.
Too, because everybody should be presumed positive.
Especially in the clinical setting. I mean,
exactly. Yeah.
So I think very quickly, I think after today, any hospital that criticized a nurse especially after JCO came out with that statement, I would be shocked if any hospital who reads the news, who reads JCO, who reads CDC guidelines, would actually complain about a nurse wearing their homemade mask. But my concern though is that what you really need is an N95 or a surgical mask, and you're coming in with something because you're afraid to lose your job. And this is where I want those kind of nurses to really sit down and look at what is adequate, what was recommended before the pandemic, and ask for that. And if they're not given that, they have to consider terminating their position. Those are very harsh words. I understand.
Yeah.
But
and I always say, you can find another job, but you can't find another license. But right now, it's really, you can find another job, but you can't get another life. And this is your life and your family's life and your community's life.
For your community. It's just, it's how we stop the spread of the virus too, by the way.
Yeah.
How we contain this virus. I mean, so that leads me to my next, problem, which is the inadequate testing. So.
Okay, yeah. What do you believe about the inadequate testing?
Well, we know 2 or 3 things. One, we know that there is just insufficient testing equipment available. Maybe that'll change, but by the time testing equipment becomes available, probably this virus will have run its course. And so because of inadequate testing equipment available, this is where we go back to, you have to presume that everyone you meet is COVID-19 positive. So, I mean, we were promised months ago that there were millions and millions of tests coming, but everyone knows anywhere in the United States that in order to get a test, you have to have you not just have symptoms, but you have to have all 3 symptoms or more. And so, in my opinion, to be honest with you, Lorie, the testing, I used to pay attention, for example, to the number of infected, but that is a bottom number.
Yeah, it's not accurate.
Right. We now know that those numbers are probably 10 times the number. And so I'm paying more attention now to, in each community, what is the hospitalization rate? What is the intubation rate? What is the ICU admission rate? It's sad, but we just have to acknowledge that this is where our government failed us and we don't have adequate testing. We could have and we should have, but we don't. And so this is why the stay-at-home orders, the stringent lockdown, it sounds barbaric, but that is the only way to track and contain the virus, is to isolate it. And so you just, at this point, you have to assume that everywhere you go, everyone is infected. And the only way to protect yourself is to stay at home as much as possible. eliminate your contact with the outside world as much as possible. It's going to be for a short time. It seems like forever, but it'll be over with before we know it. And this
will pass.
But along this line, since we're talking about healthcare providers, if we're going to have available testing for anybody, it should be first and foremost for the healthcare providers. Okay, end of. Why? Obvious reasons, because they're either carriers or they're patients. And so either way, I mean, we're hearing stories, for example, about healthcare providers who think they're getting the illness. They get the test and then they wait 5 days for the test results, and their employers are asking them to work until the test results come back. That's insanity.
Yes. If
you are symptomatic, you must stop working. You must call in sick until you get a test that says you're good to go, and then you have to go back to the universal precautions, which, by the way, universal precautions is just, it's standard procedure now on all patients, period.
Right. And even though in the testing is false negatives too.
Oh, I mean, I can link you to the study, perhaps if you want that, to put that in your notes. There's a study that came out that said, it just depends greatly on where you get your swab and all these variables. But the bottom line is we now know that the false negative rate is about 30%, which is really scary. And that's, again, because the government failed to provide adequate and sufficient testing early on. We still don't have it.
Yeah. So let's move on and talk about like student nurses or they're finishing, they can't even do their last semester of clinicals and they're putting them in the workforce without even taking the NCLEX. What are your thoughts on that?
So for states that are recruiting student nurses, I would strongly recommend the association to get involved and the board to get involved if possible, but particularly their association. I mentioned to you, my thinking on this is that there's 4 areas where healthcare providers can address COVID-19. One is in the prevention area, where you're teaching and educating people about sheltering in home, washing hands, etc. And that's a very important area. Nobody should diminish the priority of prevention. It is huge. But education and training is something that nurses could be involved in, student nurses could be involved in. The next level that I see is caring for non-COVID patients. There again, though, if student nurses are going to come in and care for non-COVID patients, they have to be really up to date on universal precautions. They have to be trained and taught to presume that every patient is COVID-19. And the level of care should be a very low acuity, right?
Right, right.
The next level of care is what I call A and B, 3A and B, and that is caring for COVID-19 patients in the outpatient setting. Some of that is being done through telemedicine now, where the nurse is not risking infection. But again, we want to be able to have the supervision and oversight of a registered healthcare professional. So, but that's one area. And then the next area, of course, is caring for COVID-19 inpatients. And then the final area that I look at is caring for patients in the recovery phase. So I personally, this is just my personal opinion, I believe that student nurses could probably, if they felt comfortable and depending on their training, they could care for patients in the prevention area, in the post-recovery area. I would leave the other areas to the registered and trained professionals. And again, this is for everyone's safety, everyone's safety. So that's a recommendation if they have to be involved at all. But again, these are crisis scenarios when you're inviting student nurses or retired professionals or non-clinical professionals. But that would be my recommendation. Involve those people, but involve them on prevention or recovery. Don't involve them on caring for patients.
Yeah. And my concern with the students, if there's any students watching it, my recommendation is be very careful. To become a registered nurse, it takes a couple of years to get what I call your nurse legs under you, so you can make these judgment calls and know exactly what the standard of care is. And by throwing you into the fire, I'm concerned that they're going to set you up for failure or for a board action when you don't even have a license.
Right. The board will say something like, God forbid, but a death or injury occur under your watch, and the board is going to come up with, well, this is basic knowledge. You should have known that. But the fact of the matter is most student nurses who work in a clinical setting are under a preceptorship for a long period of time, even after they're registered, Lori, even after they're under a preceptorship. So it's not just you get your license and you're ready to rock and roll. Depending on your setting, you might be safe, you might be okay to proceed. But in a high acuity setting, you're never going to be put in that situation without a preceptorship. So don't do it now for people. Don't do it now, because the board will not, for anybody who thinks that boards who regulate and license nurses are their friends, that's a grave error. The board is not your friend. Their job is to protect the public. And so even though you're doing this out of the goodness of your heart, if you make a mistake that they consider to be one of basic knowledge, you may find your license shortly after you received it revoked or suspended.
And you may not have even had your class in ethics and jurisprudence yet to even know what the Nurse Practice Act is. If you are in your last semester of school and being put in the workforce. So be careful. Your license is a privilege. It's not a right. So we want to make sure we set you up for success. And the nurse residency programs out there are typically a year, even though the nurse preceptorship programs are not that long. But to get a really good, solid feel for nursing, it takes at least a good year to really get it under your belt, and sometimes longer.
Make mistakes that first year. I know I did.
Oh my, yeah. It's scary. It's really scary. So we want you to be the best nurses that you can when you're out there, but we want you to be successful and not not say, oh, let me in there. I'm so excited. I can go to work early. I can get paid. It's not worth it. And at least in California, they're allowing the students to work as CNAs and not giving licenses early. But I know other states are like, no, yeah, you can get licensed early. You don't have to pass the test or anything.
I'm just going to take a deep breath on that one, Lori.
Yeah. Well, anyways, thank you so much for your time, Kimberly. You have been such a wealth of knowledge. We really appreciate it. And again, know that everything's changing. What we say today could be completely different tomorrow. And I think Kimberly made a really good point that the standard of care doesn't change just because there's not availability of masks and equipment to protect you.
Right.
And
standards, if you want to know what true safety, genuine safety is, and follow those. But again, be proactive. My message today is be proactive. Don't be reactive. That's
absolutely.
Message
so again, thank you so much for your time and your information. And to our listeners, thanks for tuning in. We so appreciate it. We really care about you. We are behind you. We're supporting you in every way we can. Take a look at the Nurse Attorney Association position statement at TAANA.org, TAANA.org. And we just wish you the best to survive this pandemic and of course in your career. And if you're enjoying this video series, please share it. Please share it with everybody you know, and have them go to Empowered Nurses, past tense, empowerednurses.org/COVID, so they can get all this information as well. Thanks everybody, and thank you, Kimberly.
All right, good to talk to you.
Thank you, bye.